Welcome. We'll call to order Anchorage Equity Committee of the Assembly. We've got a number of interesting and exciting things on the agenda tonight, or today, I should say. It doesn't feel like nighttime. First off, do we have someone who would volunteer to do a land and labor acknowledgement today?
Well, I guess Rebecca Berry.
Okay.
All right, on the land and labor acknowledgement, we acknowledge that the land that now makes up the United States of America was the traditional home, hunting ground, trade exchange point, and migration route of more than 574 American Indian and Alaska Native federally recognized tribes and many more tribal nations that are not federally recognized or no longer exist. We recognize the cruel legacy of slavery and colonialism in our nation and acknowledge the people whose labor was exploited for generations to help establish the economy of the United States. And we're really excited about the fact that Celeste and I just left a meeting where Governor Dunleavy signed into law legislation in the state of Alaska, the celebration of the Juneteenth holiday going forward. Yeah. We honor indigenous, enslaved, and immigrant peoples' resilience, labor, and stewardship of the land, and commit to creating a future founded on respect, justice, and inclusion for all people as we work to heal the deepest generational wounds.
Thank you, Pastor May. Okay, let's do a round of introductions. We'll start here in the room. I'm Thea Agnew-Bemben. I'm one of the co-chairs of the committee.
I'm Pastor Leon May, and I'm one of the co-chairs of the committee.
I'm Celeste with the Alaska Black Caucus.
Jasmine?
Jasmine Akers, Deputy Clerk and staff to the committee.
Great. Director Ash and Chris. You guys could just come and sit here. That would be great. I know, we're just doing introductions.
Oh, okay.
Kimberly Rash, Acting Director, Anchorage Health Department.
Michelle Farabach, Public Information Officer with the Anchorage Health Department.
Joe Ryan, State Lead and Last.
Okay, let's go online. I can see Cameron. You want to introduce yourself?
Sure. Hi, everyone. Good afternoon. Cameron Perez-Verdia with the Anchorage Assembly.
Great. Thanks for being here, Marie.
Yes, hi there, Marie Husa, committee member.
Great. Good to see you. Hannah.
Good afternoon, Anna Jerusi, committee member.
Great. And Felix?
Hi everyone, Felix Rivera, Anchorage Assembly.
Great. And we just have a couple more folks coming in the room, so we'll give them a second to sit down.
Celeste is going to call in.
Okay. And Celeste is going to switch to being online. That's all right. Taylor, do you want to introduce yourself when you're?
Hi everyone, my name is Taylor Donovan with Rural Cap. Excited to be in person. Nice to see you all.
And Marita? Oh,
There you go.
I'm Marita Bibiawag with the Alaska Federation of Filipino Americans Inc. I'm here for the meeting.
Yay.
That's the meeting for 3 months.
Great. That's great to see you. Great. Anyone else joining us online that didn't get to introduce themselves yet? Or on the phone? Okay. Awesome. Let's get going with unfinished business. At the end of our meeting last time, we had some discussion, just kind of brief discussion at the end about whether and how the committee might want to be involved with drafting a resolution related to following up on the language access audit. And I just want to call your attention also to an email that Jasmine sent today, sharing a document that the municipality shared. Unfortunately, they shared it in an email that didn't go to Jasmine, which was the oversight. So that's why you got that document kind of late in the day. But the document does what I think also was requested at the end of the meeting last time, which was to provide more of a written report on the response to the findings in the audit. And so if you're here in the room, we've got that printed for us. And if you're online, you've got that in your email. So with that as a reference point, let's have some debrief about that presentation last time, and then specifically discussion around, do we want to be part of drafting a resolution related to following up from the audit. And before we go to discussion, let me just let a couple other folks introduce themselves. Lori?
Hi, I'm Lori Pickett with Alaska Literacy Program.
Matthew Hurt, Legislative Counsel of the Assembly.
Great. And then we have one person joining online. Last four digits of your phone are 8500. Do you want to introduce yourself? Or maybe is that Celeste perhaps joining?
So, hello, this is Erica Berry. I'm the Director of Dallas City Opportunity. I am sorry, just in my office finishing something up, but I just wanted to listen in on the meeting.
Perfect. Okay, great. Thanks, Erica. And you were here, just for folks to know, Erica was here for the presentation last meeting around the language access audit. Okay, who wants to get us rolling with discussing and debriefing from that presentation?
Well, I did have a question, Cameron, and I'm thinking that this was in line with your recommendation. We were talking about the resolution aspect of it. I think what Junior and Michael submitted, I guess that was in response to what the resolution should have wrapped around or whatever. And so they submitted this, and so I don't know if we are still thinking about doing a resolution or if this suffices.
That may have been a question to me. Was that a question to me?
Yes.
I was just looking through my email. I am trying to find it. Who was it sent from?
Michael L. Curry, I think, the liaison.
Actually, yeah, you would have gotten that earlier from him, and then Jasmine also sent it today, so probably got it twice.
Okay. So I haven't seen it. I'll look in my email for it. But yeah, I think it's really this. I think the debate or the discussion around the debrief of the report from Junior and others, and also this, I think is the discussion to have today to see if there's any follow-up that the committee wants to do and whether a resolution is in order or not. But I'm not sure. I have not read the report yet. Thanks.
So I was thinking that this was his response to your recommendation about a resolution. They just went on and drew it up, the report up, and sent it to us. Yeah.
Well, I want to apologize for missing that meeting, especially because I asked for it so strongly. But I did read the report, and that's what we're discussing right now is sort of our feelings around the report. I was happy to see, it feels like it's a very honest discussion about what's happening around language access, and I'm really grateful for that. I do feel like after reading this that there's really a lot of room for opportunity for growth, because it feels like language access is being viewed only as an opportunity to use an online or a phone interpreter, but there's no discussion of plain language. There's no discussion of any deeper training about working with the English language learning population, except for if somebody asks for assistance using Language Link. And there's a lot that goes into really training people on when it's appropriate to use family members and a lot more information. And there's some really good resources and people out there. So I'd be really curious to hear from them what the resources that they're using to build the language access plan, what the training looks like that they're giving to each individual department, what the reporting looks like, how we work to support any of that. And we're happy to help. I love our language access information that's on our website that Aaron worked so hard to put together. And there's other organizations here, AIJ and LASES, I know that worked really hard on that. And ISA is probably not online. Today's the big refugee celebration, so there's a lot going on today. So, and thank you for being here, Kim. I came for you instead of the refugee resettlement to be supportive of you coming and talking with us, so thank you for that.
So could you just, sorry, I just want to take some notes around the questions we have and kind of follow-up items. Can you just kind of summarize the questions that you just shared around follow-up?
Sure. What resources are being used to really dive deeply, like Welcoming America resources, plain language resources, other organizations work like ACPIRG, AIJ, AOP, are being used to really help the city develop a really comprehensive, strong language access plan. What does the training look like that's being given to each individual department? What community outreach around hearing from the ELL community is happening around what their experiences are trying to receive language access and what would work best for them. We get a lot of input at Alaska Literacy Program. I hear that the health department is the one that does use Language Link and has some language access. That's the one department within the city that I've heard things about. Also AWWU we've had some success there. So I appreciate that they highlighted, I didn't see the health department highlighted in this one. Are those enough questions?
That's great.
That could go on.
That was really good.
I just have one thing. Oops.
Joan, you go ahead and then we'll get to Hannah. Yep.
Is it possible to compensate the people that are already doing translations for the goodness of their heart? And they're putting their knowledge into it and getting paid the same. So that's just my suggestion.
Current employees of the municipality?
Yeah.
Okay.
Yeah, there's a bunch that just translate their second language, and then they print the flyers and stuff like that, and they're just being compensated.
So that's a really good question to ask. Like, how is the municipality evaluating how they appropriately compensate those with the multi-language skill set? Yeah.
Hannah, go ahead.
Good evening. I am still stuck in the last meeting. I listened to Assemblyman Perez Verdilla when he requested what he felt should be a report. And so I read the documents that were sent, and from a healthcare perspective, it's not a report. What I read was sort of creative rhetoric, but I didn't see a lot of thorough, evaluative facts, department by department, regarding language access programs in the report that was sent. And so I'm still stuck on not really understanding just how the Muni is still lacking in this process, because the report didn't seem to really discuss in detail each department and what's going on. It was sort of a defensive kind of creative rhetoric rather than a fact data report. So I'm still stuck on, so it's hard for me to make any kind of resolution or come to that because I still don't have all the information. I feel like the report is still lacking a lot.
So Hannah, maybe a follow-up question to that, and just to kind of get us to the other item on the agenda under this topic is, what are your thoughts around, is there a resolution needed to get additional information, or do you have any thoughts around that question?
I guess I'm trying to still understand the process. Again, as a healthcare provider, we're very direct. Does there have to be a resolution around getting all the data and all the information? Is that the politically correct way to do it? Or should it just be there? I mean, I just am really torn with having to even ask for this. So somebody help me out here, because I'm still really passionate about the last meeting and what was lacking in some areas in the community. For example, the police department. So is that the process that we have to demand? We have to create a resolution to make this go forward?
Personally, I would think that if we acknowledge the last line in the report, in the conclusion, where it says, "I'm proud of the work we've made toward reaching that standard, and we'll be more than willing to work with the Anchorage Equity Committee of the Assembly on not only maintaining but improving the standards of the language access program." So my thought on that would be, in lieu of a resolution, because this was their response to us possibly doing a resolution. And my thinking would be that at some point we schedule them to come back in and we have a list of questions and ideas and thoughts and all of that, and we could share that directly with them on what our thoughts are relative to this report. So I think in terms of a re-invite would probably be the most appropriate way to go with that.
I would agree, because there are too many gaps in information and data. There's too many, as I was listening, there were too many wait, what moments. And so I think coming back, and I don't know if it's appropriate to send them with a list of questions or just coming back with a complete report would be great.
Yeah, because I think this was just simply an itemization of the process that they looked at and embarked upon in lieu of nothing else being in its place, and giving us some idea of the transpiring of what they actually tried to do to get this thing jump-started. And so I think if we come back with all of our questions and all of that and look for a little more accountability in the process, because I think it came up in the last session, question was being raised about specifically the training, but it was no in-depth answer to what that training looked like or any of that. And so I perceive that that is still a question, and a very valid one.
Thank you.
Cameron, go ahead.
Thanks. I just wanted to respond to that. In terms of process, you know, this committee essentially functions as an advisory committee to the Assembly, and the Assembly is an oversight body in some ways for the mayor and the administration. And so as the new administration is coming in, I think it would be really appropriate for this committee to draft a resolution saying we recently reviewed the audit, and we had a report by the chief executive officer, and we're concerned about what we heard, and we're concerned about some of the areas that are really lacking within our city, and here's what we would like. We'd like to see more information. We'd like to see, you know, what the plan is to improve this, and really sort of saying to the Assembly, will you please, you know, ask the administration or compel the administration to give this to us. I mean, I think you can also communicate directly to the administration. You could just write literally a memo or a letter to the new incoming administration saying the same thing. But I think there does need to be a communication between the committee and either the Assembly or the administration, you know, voicing that you've reviewed this information, you've had this presentation, and there is more that you'd like to see, both in terms of more information, and you'd like to see a plan for how over the course of the next few months and year this is going to improve. And I think the new administration would really appreciate that, knowing that that's a priority of yours and would likely respond to it. So regardless of how you do it, whether it's a resolution to the Assembly or just a direct letter to the mayor, I think it's really appropriate for this committee to develop something and vote on it and have it sent.
Any other question? Or is there something else?
I think. I'm forgetting who 8500 is.
It's Erica.
Erica, did you want to respond? I saw your.
Oh, no, sorry, I didn't mean to hit any buttons.
Okay, sorry about that. Any thoughts on Cameron's suggestions? Yep, Lori?
So Cameron, I'm curious, since we are to advise, an advisory group for the assembly, it seems like it would be most appropriate that our communication would at least go first to the assembly or go to the assembly and the administration without bypassing that. But also, what about the appropriateness of asking the assembly to consider to investing funds in potentially bringing in somebody from the outside, a contractor, understanding language access plans and this kind of work. There's not, I haven't run across a lot of people even in the state that are familiar with this outside of the Alaska Native community. And so I think that people are being assigned these tasks, but might not be being assigned the resources and access to the experts in order to actually do this work. And so I hate setting up an individual employee who's really trying to do the best that they can. So what do you think about that?
Yeah, I think that, well, first of all, the purpose of this committee is exactly that, right? The purpose of this committee is to bring in community voices on issues related to equity for the municipality and to inform that, make recommendations, to advise. So that's exactly why this committee exists. And I think pulling in the expertise and the ideas and the creativity of this committee and communicating that directly to the administration, I think is really important. We're, as the assembly, we are policymakers and we're funding allocators. So in terms of doing those things, we can certainly assist. But I don't think it has to be going through a formal resolution process. I think that this, and I'd love to hear Felix's thoughts on this, but I think that this committee essentially needs to communicate their concerns and their desires to both the assembly and the administration. So I mean that certainly can be done through a resolution. Or it could be done through a letter. Felix, do you have a perspective on what you think the best pathway of that would be? Curious of your thoughts on that.
Yeah, thanks, Cameron. For my part, I think I agree partly with Hannah in that I do think it makes sense to get more information through a letter, a memo to the administration and asking some very detailed questions to them. And I think from there, then this committee will have a better sense of some of the gaps. And we'll be able to, via a resolution that you can send to the assembly, send to the administration, provide some strong recommendations on how to move forward with bolstering our language access program as a municipality. So for me, I sort of see it as a two-step process. Learn a little bit more, then make your recommendations.
That sounds like a really good approach. Is there any further discussion on that approach?
Well, Felix, when you speak in terms of learning a little more, then that brings me back to where I was originally, by having more question, answer, input kind of thing during our meeting time, if we're gonna, make recommendations following some more learning.
I think if, I've been taking notes on what people have been saying today. Like, I think if we had a subcommittee, like an ad hoc group that was willing to kind of distill this so we could communicate it to the administration saying these are the things we're still wondering about, and then have them come and discuss that with us. What I hear Felix saying is then, armed with that information, then maybe that same small group could come up with some recommendations of, do we need to hire somebody, hiring an expert is a great idea, but I also wonder about the organizations you mentioned, and is it more like, we think the assembly should contract with, a competent organization to actually do the training and the, this and that, I don't know what's needed.
Yeah, this is Cameron, just one other addition. I really like what Felix said, because I think that, again, the action part of it is making recommendations to the assembly that we would then take action on. We would allocate money, we could do those kinds of things. But there may be more information that needs to be collected. So this is a committee where you can compel people to come and provide that information, whether that's more information from the municipality on what exactly is going on and what's not, or whether that's bringing in those experts to this committee to advise the committee on what actions they think that the municipality should take. So this is the location to gather that information and then to make those recommendations to the assembly and the administration.
Do we want to identify a small group to work on this, or how do we want to move forward?
I guess what we can do, for me, since they're saying in their conclusion here that they're, she's not really, they don't have enough tools, or there seems like they're stuck on this one. So I think I agree with the committee, with us having a little committee to work on and to see where they at in this one, because she said something about this, that I'm concerned is that the state program is what's given to me is up to the standard, and they're not so sure because she's just only getting into that whatever the PNP, and that's what she's concentrating on, and they're not moving forward. So if you can verify or check and see where we can get more information and how to build a letter or recommendation or something from our part to the assembly, sir. I don't know.
Yeah, and my thought again is we've had them come in and we're left with more questions than we have answers. And once we detail some of the questions, my thinking would be to at least give that department an opportunity to weigh in on it before we start going in a million different other directions.
Yes.
Would it be appropriate for us to ask for, I am well aware that ACPER did work for the municipality that they shared with it. There's good work that was left behind by Amy Kaufman. I also know that the previous equity officer had, I had been in conversation with him where he had prioritized and was gathering information on language access. So there's already certain things that exist that the city has or should have, or maybe we could recreate and find from those who submitted them, that we also can request access to those documents. And I'm happy to work on the subcommittee.
Who was the last person?
Clifford.
Okay.
Yeah, there are some documents online actually. The lady that came last week, I can't remember her name, from EEO.
Erica, she's on the line.
Yeah, so there's a language access plan, I think it's pretty new, that's online. And I read it and it's pretty good, but it's just for that office. I wonder if that can be replicated, or at least we can look at it.
Well, and they make reference to past employees a lot, but that's really specifically Amy Kaufman. They're just not naming her. That she had produced these documents and had systems in place back in, what was that, 2020, 2019?
I thought the one that I read was pretty new. I think the one that I read was pretty new.
Yeah.
And it has like the purpose, the definitions, etc.
So that'd be good.
Celeste, and then we'll kind of wrap this topic up. So go ahead, Celeste.
Okay, so I'm just wondering, the city's affirmative action plan, it seems like this is where that information would land, and that we would have the information for all of the departments. So I'm not quite sure, other than to say, the city and the health department, they don't have the resources to really do a great job with this, because they're busy doing all kind of stuff. So it seems like we just need to get somebody that could focus on this, because it's been a problem for a long time, a lot longer than what many would even think. I remember when I worked for the city 14 years ago, it was a problem then. And so I just think that it has not been a priority, and the work that's done is not done in a way that the community needs, because they don't have the resources to do the work. Thanks.
Thanks, Celeste. Okay, so I've heard Lori and Hannah are both willing to be on a subcommittee. Others?
I can be there.
Joan, great. Anyone else?
Well, 3. You can't get beyond with all of it.
Well, I think the way we've done it in the past is we've just asked Jasmine to do the public notice. Is that right? Or Jasmine, tell us what's best.
You can't have more than 3 meet, but if you want to have more, yeah, you'll have to notice it and have a public meeting, so it will have to be in this sort of setting so that the public can participate. More than 3 days, you just have 3 members, they can meet.
Yeah, that's what I was speaking about, the 3.
Yes.
And my thinking of, if we're gonna do a subcommittee, and I think the starting point would be, since they took the time to give us a report, a starting point would be, I wouldn't necessarily call it a rebuttal, but a starting point would be addressing what's lacking in the report and include all the other questions that you guys might have as a subcommittee relative to getting to where we need to go with this.
And then I think in terms of timing, I think we could add this to July's meeting, right? Because August will be a little tied up with all the new co-chairs and whatnot, but July, I think we're pretty open. Okay, do we want to go ahead with just a subcommittee of 3 to keep it easy and then ask them to come in July? I guess one question is, will the new administration have their staff in place by then to talk about this with?
I think July's gonna be tough.
Yeah.
Yeah, should we maybe add it to August and just make time for it?
Yeah, I think it could be more time.
Well, what was that?
That's fine with me.
I mean, I was gonna say, if that was the case, then maybe we're talking about, if the committee has to meet and question and answer rebuttal to the report and fine tune what we want to ask and all of that, I would think September, 2-month period for that. Or is that, what do you think?
Well, like
Since you
Celeste
followed
pointed
through.
out, we've been waiting more than a decade.
Okay. What?
Can work happen? It's odd for me to have to work in a public notice space, but if we work on pulling some of this together in a living document like a Google Doc, can we share it with the committee? Can that go out and be shared and people can have comments? And we could potentially send questions and requests for information ahead of time so that we could get answers in September?
Sounds like a great plan, Lori.
Thank you, Hannah.
Okay, there's a conference going on about about what's legal. So I think we can move on from this until we hear back from these guys, but we'll go with the 3-person committee, which doesn't need to be public noticed. You can meet and think about an invitation for September. I think unless you guys decide like, no, we really need answers sooner after you meet. Does that seem okay?
Also, as you mentioned, there's going to be a change in administration,
Yeah.
so it's going to be kind of convoluted.
Yeah. So maybe.
I'd like to make enough noise so that this isn't a topic they're hearing right away from a lot of places and spaces, because it's been one of the most ignored.
Yes. Yeah. Great. Okay. We'll move on to our next topic unless there's any objection. Great. Okay. Do we have any new member nominations? Okay, hearing none, we can move on to our main part of our meeting. Welcome, Director Rash. So we, just to refresh everyone's memory, we in our work session for the year, decided that one of our priorities was to work with the health department and just think about all the awesome programs that are part of the department, and are there ways that we could increase equity, increase access, and just help AHD kind of broaden its impact. And so we worked on we had a small group, we worked on a document together, which Jasmine can put up on the screen. And this was like really just looking at the website and pulling information from there. So if stuff is not correct, that's because we're just, going in a pretty cursory way. And we did try and identify some opportunities for health equity in one of those columns of that document. And then on the very last page, we met and kind of brainstormed, like, what are our goals? Like, what would we want to see out of an engagement with AHD? And also just want to make sure it's clear that, like, we're here to, like, help and partner and make it cool and better, and not to, like, attack or criticize or anything like that. So that's the spirit of having you here today. So with that, I'll just hand it over to Director Rosh and to share whatever you'd like to share, and then we can just kind of get into conversation together.
Perfect, thank you so much. I appreciate your invite. So I'm very excited. So if I may just digress for a quick second too, back to the language access plan from the department view. I do think that the data within the plans do need to be updated. So the plan itself is a template. Ours is a template that we received, I believe, from that lady, Amy Kaufman. The data in it is from 2017, so it is very outdated. So that does need to be updated. As well as I think there needs to be training, and there needs to be annual training for staff. I think that's really key, is driving home the importance of why this plan is important. Why does it exist? And I think that's a piece that may be lacking currently. So thank you for that little digression. Back to the health department. So to give an overview of the Anchorage Health Department, some of you may know this, some of you may not. We have 5 different divisions within the department. Our biggest is clinical services, and that is also where we have the largest amount of vacancies currently. So we're at about a 19% vacancy rate currently across the health department. Within clinical services, we have 3 main areas. So we have our DPC area, which is disease prevention control, which handles infectious disease. We have immunizations, and then we have our STI side. Within the STI side of the house, we also address those with HIV, as well as our teen unintended pregnancy program. So we have an outreach worker that goes out to schools and provides education on what healthy relationships really look like. And then in addition to that, we now offer a lead clinic and a well baby clinic. So those 2 programs just started about probably 3 months ago. Fairly new, fairly still trying to get them off the ground. Clinical services is primarily funded through the state of Alaska. We have a grant through them, which helps provide personnel support as well as the day-to-day operations of the clinic. We then have our public health.
Can I just ask you a question? I just didn't capture what you said. So you said there's a well baby clinic, and then one other thing?
Lead.
Oh, for like lead exposure.
Yes.
Okay, gotcha. Thank you.
Yeah. Then we have our public health division. Within public health, we have emergency preparedness and response. So in case there is a public health emergency, we would activate our team. It's a very small team. There's only 4 employees within that team. They would work with OEM, which is Office of Emergency Management, if there was another pandemic-like experience that we have. We also have within that division WIC, Women, Infant, and Children program. And then we have our environmental health services, which goes out, inspects facilities, pools, spas, barbershops. We also do marijuana shops. We also handle noise complaints, and various other tasks. Within Human Services Division, we have our CSD, which is Community Safety and Development Team, which is not the great name for that team, but they handle all of our HUD funds, Housing and Urban Development funds. And then we have ADRC. So we have one of 6 ADRCs in the state of Alaska, Aging and Disability Resource Center. And they do a lot of outreach. They do a lot of person-centered intakes, really trying to connect individuals with services, supportive services, long-term services. And then we also have child care licensing. So we license all facilities as well as homes. They also handle a lot of complaints. I would say within the past year, they have handled more complaints than they have in many years for unlicensed home operations. So that is obviously quite concerning and does take up a lot of their time to address those needs. Then we also have housing services, which is a newer division within the health department, which handles all of our homelessness within the municipality. So housing and homelessness is handled under that team. And then we have the administration division, which handles grants and contracts, fiscal, so all of our accounts, as well as we have an HR liaison, which makes us a little bit unique of a department. Not a lot of departments have their own HR liaison, so we're really thankful. And then we also have a data analyst. So high level, we offer a lot of services to the municipality on various different fronts, and really trying to make sure that we don't have a lot of barriers to care, right? Because one of the things is why we exist is to provide care for our community, provide it at low to no cost. We are the safety net of the community. And we need to make sure that we are leveraging funds as much as we can to provide those services. So something specific within our clinic, and I know that it was outlined in one of these documents, is, if you have a client come in, they're unable to pay for services, really what happens? Well, we provide the services, bottom line. And then we have a sliding fee scale, and so it slides all the way down to 0. So if an individual cannot pay, obviously that's not going to be a barrier to the care that they're going to receive. We're going to provide it, and then if they don't have a means to pay for it, that's okay. And additionally, within our clinic, we don't really have to have a photo ID. So a lot of our transient population, sometimes they don't have IDs, and so we're still going to provide the care, we're still going to do the testing and the treatment, and providing that to our community. So again, high level operations of the Anchorage Health Department. We have worked very hard to fill our vacancies, because obviously when you have vacancies, our service level has to fluctuate. We simply can't have staff either working above their licensure and or doing so much work that they can't get anything done. And so I would say within the past year we have reduced that vacancy rate. It was almost 38% early last year, and we've reduced that down to about 19%. Really trying to make it a great place to work, where people want to show up and that are passionate about the work that we're doing. One of the things that you can see when you come into the health department is the camaraderie, the teamwork, the ability to just get in there, get the job done, and show up for our community. We have outreach events, so we've increased our outreach events within the past 2 years, so coming out of the pandemic. Obviously the pandemic was very impactful in that it shut down a lot of the operations. We didn't get out into the community as much as we did. And so we have a mobile clinic that we're trying to get out in the community more often. We have tried different ways of, different hours of events, weekends, looking at where the biggest impact that we can make. When we show up to events, we provide services across the board. So in the past, when we would do a clinic outreach, it would focus on one of our services. So right now we try to offer all of our services at the outreach events, because you don't know who you'll run into. You may run into a family and they need their children immunized. So why don't we provide those services while we're out there? Or someone may just need to be checked for an STI. How can we maneuver that? Where can we be located so we can provide those services? So yeah, kind of what I have, I know that there was a lot of information. So Michelle Fairback is here with me today, and we were trying to go through some of this information, and we do realize that our website probably doesn't accurately reflect all of the work that we do. And I think sometimes it's the community doesn't know what we do. And so when we tell them, like, hey, did you know we did this? And they're like, oh, I don't know that. I didn't know that. And so one of the things we're also trying to work on is making sure that not only does our website reflect that, that we're using our social media. We have passed a few passed a few resolutions really outlining the work that public health officials do, honoring their work, trying to bring awareness. So we had back in March, I think it was March 24th, was World TB Day. So we did a resolution on that. We did a huge event on that. Really what we do is try to bring awareness to issues that are happening. Obviously, sometimes we can't reach all of our community members, and so we're trying to look at, like, how do we do that? How do we get that message out? We do, as Lori mentioned, use our language access plan. We use Language Link. Sometimes it is a bit difficult. When you're out in the field, how do you provide that service? Yes, we can use the phone, but how do we provide it in real time? You're standing there, you really want to help this individual. Is there an ability to get someone there that can be there? Oftentimes, too, what we see is, and one thing that, area that we are working on within the health department is working between the divisional boundaries, right? We have these 5 different divisions. How do we get those staff to work across those boundaries? Because a lot of times the clientele can be the same that are seeking services. And so one of the things you really want to focus on is that person coming in once through that door and providing them that holistic support, not having them come back for various levels of support, like, oh, did you know we offer this? And then having to schedule them for an appointment. So how do we do that? And so that's something that our executive team, as we built it up, is trying to really figure out and coordinate, and then really get that message down to staff, and really have them understand what the other divisions do. As much as, we hear that within the community, sometimes we do hear it with staff. I didn't know that this other division did this, or this other program did that. So how do we create that communication? And so we try to communicate with all staff during our division meetings. We try to get the supervisors to provide updates of their program areas and what they've, highlights of what they've done, or specific to a program or an event that they've hosted, to bring awareness again to that specific job that they do. So, yeah.
Great. Michelle, do you want to share anything before we kind of get into questions? Or
I don't have too much to add. I don't want to digress too much to the language access plan, but I was looking at what I think the 2024 updated plan for the data, and as Director Resch mentioned, that is a little outdated. And I know that People Mover polled and I think shared during that May training that they had 2022 or 2023 American Community Survey data that was a bit more, I think, relevant. So I just want to let you know about that. Otherwise, I don't have too much to add. I think our websites, we do have a website that's dedicated just to the clinic, and then we also have the muni.org website, and so there are quite a few updates that need to be happening on both of those sites, and I've started some of them, but I'm always happy to, if anybody notices anything, just to let me know. Sometimes community members tell us, hey, I noticed this is outdated, can you please update it? And we do that as quickly as possible.
great, thanks for that overview. That's really helpful. So in the document that we worked on, we did come up with some kind of questions related to different programs, but maybe a better place to start is just with our questions and goals on that last page. And I think one of the main things kind of follows from our questions around language access, and maybe if it's okay, we could just start with that first batch. But you know, and I want to open it up to the whole committee, but just to get us started, you know, what are some of the things that the health department is doing? I mean, we've heard today already that actually compared to other departments, you're doing great with the language access, but what are some of the ways that you are really trying to reach out to diverse communities and help people know what you offer and how you can support them? And then I think we also just kind of in that same vein, like how many people are you serving? Like what percentage of the population is actually really accessing your services? And like, do you have kind of communities that you would like to engage with more? Because I think that's part of the value this committee brings is a lot of connections. So maybe you could talk a little bit just about those questions to get us rolling.
Yeah, great question. So in regards to how much of the population we're serving, I don't have that information offhand, so I'd have to get that for you. In regards to, you know, how do we get out in the community? How do we look and figure out what communities need what? It's really by word of mouth at this point. And it's really by the connections that we've already built with community partners, and where they would say, you know, hey, I think it would benefit if we went here or we went there. And so that's kind of how we're handling our clinic outreaches. I also know that in WIC, we have an individual, an employee, Betamar, who is absolutely amazing. And she is able to really connect with a population of individuals and really connect with them in a way that's meaningful and provide additional information about the health department. I think that ways that this committee can help us is really if you hear of something, if you hear of you know, a group of individuals that may not be receiving our services or know what we do, providing that connection. I think that's really, you know, how relationships start, right? If you look at friendships, and I know it's kind of basic, but you meet a friend and then you meet another friend through another friend, and then all of a sudden you have this larger network. And so I think if we can continue to engage with this meeting and this group, I think it would be beneficial because, you know, we're really trying to meet the demands. Sometimes the demands far outreach our staffing capacity, but as long as we understand the needs and start there, I think we can start to address how do we show up for people.
Thoughts from committee members on how to, like, maybe you all have heard probably about who is accessing services and who's having a hard time and how we can help with that. Go ahead, Joan.
Yeah, thank you, Kim. With Alaska's, we would love to help you out, and if you have any outreach event or anything to engage the Hispanic Latino community, for us will be if you have a flyer in Spanish and in English, we will love to put it in our social media, for example, and that can be for any event that you have with the health department or when vaccinations are out for the flu, for example. So you can send us all that information to our email or even to the committee, and we'll just put it out in our social media. And that's for Alaska, but I know that other communities have different languages and different you know, culturally appropriate things to do. So yeah, that's what I just wanted to extend my hand in the Latino Hispanic community.
Right.
Hi, thanks, Kim. A couple things that came to mind is first that Benmar is amazing, and I would say that one easy thing to build in would be maybe other staff members and time into those particular staff members' time to do that connection work as part of their job. I know sometimes the funding is complicated, so like if they're federally funded only for this, you have to put in like other special hard to get admin dollars to allow all of that. Betamar spends a lot of time with us at ALP. You know Betamar, she's a famous member of this community who does a lot passionately and a lot volunteer to help build those connections. There's also a lot of work happening around the community-based workers and the CHWs statewide through APCA, and we've really wanted to connect hard with them based on the way our peer leader navigators are sort of informally doing that work. But it looks like the state, based on what I'm hearing, might be moving to a more clinical base. And so I would recommend like really finding a way that we could connect and be involved in that, because what we see too is what you described is where, you know, people come in and they have many different issues, and so they might be there because they need a TB test, but then they need stuff that would be available at different departments, and we're seeing a real lack community-wide for just general case management for people with multiple issues. And they're at our doorsteps desperate, and we're offering them English classes, and they need housing, and they need support with language access and all these other things. And it would be nice to know. I would like to just compliment you on a really fantastic experience we had. I don't know if you're even aware that this existed, but we had a new arrival who came unsupported, came to us and said, I need help because I know I've tested positive for TB and I don't know what to do or where to go. And because we have the connections that we have with you, when we reached out to the health department, the response was quick, it was immediate, we got attention at no risk to this person, and it was resolved very quickly. And it went from something that we were having a hard time, like, man, this is a big crisis, we don't know what to do, to engaging with people who did know what to do and how to solve that, and language access was provided. And so that was a really positive experience just within the last month. But those are some of the things, and then some of the things that we see are on the grant side too within the communities. A lot of community-based organizations, nonprofits, feel like the health department is asked to administer really complicated grants to a lot of community-based organizations. And I wonder if you feel like you're getting the actual support that the health department needs to be able to do that in a supportive, successful, accessible way. And I think that's one thing that I see that this committee could do, is to really recommend to the Assembly that you're asking the health department to take all of this on, and we think you should better resource them so that it can happen. Because several of us have had a variety of experiences. We have had some incredibly successful grants with the health department, and we've had some real challenges. And so, and I see some of that as also just being asked to do stuff under-resourced. And the hope is that can we help with that? And then, I mean, I could go on. I've got like 6 more things.
Those were great questions.
Yeah.
Director Raj respond. And Jasmine, can you tell me if there's people online with? Okay, great. Go ahead.
Yeah, those are all great questions, and thank you for that story about our TB nurses. They do an awesome job. They really show up all the time. So in regards to our grants, that is an excellent question. We get asked that a lot. And so we are one of the few departments within the municipality that has a whole entire grants and contracts team. Now, we do receive a lot of funding. We continually receive a lot of funding, and then we're asked to grant those funds back out. And sometimes that is very difficult for our staff, because the more money that comes in, the more staff time it takes to push that money back out. So if I could have a wish list, I would wish to have one additional FTE within our grants and contracts team. They have grants, they have contracts, they have agreements, MOUs that vary across every type of span. And so coming up with, what is that scope going to be? How do we work with the entity? Sometimes we have to provide a lot of technical assistance. That's one of the things we saw in, working with Thea and through the alcohol tax strategic planning is, sometimes we have to provide a lot of support in the front end for those smaller nonprofits. And so obviously, we're more than happy to do that, but that does take away time from then actually executing other contracts and agreements. And so sometimes they have to find that fine balance. And so recently, I believe it was last year, there was some funds set aside for technical assistance to work with the grantees. And that was a tremendous help. I think that there are also restrictions a lot of times that the municipality health department has to follow within the contracts. And so one of the items listed on here, is insurance requirements. Those are dictated by our risk management department. And in order for that entity to get a waiver, they have to speak with the risk manager. They have to, go over, it's a case-by-case basis. But pretty much it's boilerplate language that is in there and that we have to ask the grantees to adhere to. Sometimes those requirements within the grants can be dependent upon the funding source. Is this a federal grant, a state grant? Is it local dollars? And so really those sometimes change the complexity as well. One of the other things is, there's a process, right? And sometimes that process can get bogged down within government. And so trying to get through all the steps efficiently and making sure that we get those funds out the door as quickly as we can. That has been, an opportunity area for the health department. I think, we've continually worked on that. We've done a great job. Our grants and contracts team is quite amazing with the volume of work that they're asked to handle on a day-to-day basis. But sometimes there's those smaller nuances that takes additional time, or having to work with the grantee, or having to figure out, what is this going to look like. And then there's also at the back end of continually following up and making those payments out. One of the other questions on here on the document is, why don't, and I don't know if it was phrased like this, I'm just paraphrasing, why don't you pay the funds up front instead of being on a reimbursable basis? And really why we do it on a reimbursable basis is really try to help the entity and protect the entity, because if we were to give out all the funds in the front end, if they make a purchase that's not authorized based upon the terms of that grant agreement or contract, they would be required to pay those funds back. And at that point, are they able to pay those funds back? So really provides us just a checks and balance. We do know that sometimes with smaller entities that can be harder because they may not have the funds that they need right away to start that project that they're being granted funds for. And so sometimes they are allowed a percentage upfront, which may help shorten that gap. And so that they can at least get off the ground and running with the program or the staffing levels that they may need. And so we do offer that as just a middle ground, trying to get there as much as we can.
I kind of wish I had my document in front of me. I thought to bring it, but anyway, basic question: what is the approval process for WIC?
The approval process as in if you were to apply for WIC benefits?
Yes.
Okay, so we did, to answer that question, so a little bit, I would say probably 5 months ago, the WIC platform got updated. So in the past, you would have to print out your WIC application and you would have to apply for benefits, and it's based on income.
And what's the flow of that income?
That I don't know off the top of my head. That's a great question. I can get back to you here in a second. But what we did about 5 months ago is we changed that so that a person can apply online. And so trying to make it a little bit easier for individuals to apply for services. And so, all right. So it's based on household size and then annual income. So for household size of 1, it's $33,689. If you have a household size of 4, $69,375. 8 is $116,957. And then each additional member after 10, household size of 10 is $11,896. And then those are updated based upon the state of Alaska guidance.
So predicated upon that, household of 4, you said 69,000 something. That would be if they had income beyond that, they would not qualify.
Correct. Yeah, we would have to try to figure out some additional services for them. One of the great things that we've been able to leverage through our alcohol tax funds with WIC is our Fresh Bucks program. And so we have a program where we can give them fresh bucks, and they can pick up a box of fruits and vegetables. And then we also offer transportation as well, transportation vouchers.
So a family of 4 could have a household income of $68,000 and still acquire a WIC.
You good? I have a couple different questions, but just wanted to check if anyone online had a question or a comment they wanted to share. Jasmine, is there anyone?
Celeste.
Great, Celeste, go ahead.
Just really quickly, who makes up the panel that actually approves the grants? And is it a diverse team of folks? I'm just curious, thanks.
Yeah, so for the evaluation committee, it's dependent upon the size of the grant, and the makeup is also dictated typically by the director of purchasing. So within the past couple of years, we have reached out to MOA staff, and so as the director, acting director, I reach out to different department heads and I ask individuals from those departments to participate. So typically, I reach out to Transit, APD, I reach out to Parks and Rec, Library. Those are probably the main individuals that we reach out to. However, there is an exception where you can have other individuals from the outside. I believe that used to occur, might have been before my time here at the MOA, where there could be community partners participating. And I think that if we were able to bring in community partners, I think it would be, it would create that diversity, but it would also create, it would reduce the, I don't want to say burden, but it is a large time commitment on staff that we could then leverage both internal and external help.
And forgive my ignorance.
Okay.
Go ahead, Celeste.
No, I just see the importance of bringing in community. And, because when you start just always linking to departments, it's been my experience that they go with what they know. And, there could be some great community organization out there doing great work that would not stand a chance because they're not, nobody's familiar with them. So I just think, adding a community piece, and not just one, but a couple of slots would be great. Thanks.
Hannah has her hand raised.
Pastor May, did you want to?
Well, my question was going to be, again, forgive my ignorance, but what kind of grant opportunities are offered through the health department?
So we have a lot of grant opportunities that happen throughout the year. The biggest is our alcohol tax, and usually those are typically advertised near the end of the year. We do a lot of like sheltering, food services. Those are probably the two largest that we offer. We've received some grant funds from the state of Alaska, which required, we had grant funds. We have a human services community matching grant that we have participants can solicit for. I'm trying to think. I would say those are the biggest ones that we handle.
And I guess maybe a better question for me would be, what would I need to be doing to make application of an accessible grant? What would I need to be offering?
Great question. So I think it would definitely depend on whatever the request for a grant proposal or request for a proposal would be surrounding. But what we try to do is when one is posted on the municipal website, we try to send it out to a large group of individuals. So individuals say, hey, I want to be on your mailing list. And so we send that out to that group. And so we're constantly adding entities, individuals to that mailing list which just says, hey, this has been posted. If you're interested, take a look at it. But everything we do have is posted on the municipal, I think it says want to bid, and then you click on that, and then it has the whole list of opportunity areas.
Okay, I guess what I'm getting at, is it for particular services that are being offered by a group and they make application for a grant?
So it would be based upon the scope from the funds. So if it is for food services at a shelter, that's what it would be surrounding. So then we would be soliciting entities that offer.
That's what I'm getting at.
Yeah.
You get these, some kind of specificity to what you're applying for based upon what they offer the grants for.
Yes.
Okay, yeah.
But just to add, I mean, I think it's hard because oftentimes the language is kind of almost like jargon and makes you think that what you're doing doesn't fit. But, prevention work, some of the alcohol tax funds fund prevention, and oftentimes that's family strengthening. It can be working with youth. Sometimes it can mean working with families with young children. And I think we've talked in this group about the opportunities for communities to access those funds so that they can do that in a more culturally relevant way. And so I think sometimes there's kind of a language barrier, even if we're all speaking the same, we're all speaking English, but it's not, the words don't mean the same. So yes. I know Panna, you had your hand up.
Yes, I was curious, the Municipality of Anchorage Health Department and the Anchorage School District, specifically school nurses, had a tremendous, powerful partnership during COVID. And with the new administration, that partnership went away. And so what might be in place to reinvigorate intersectoral partnerships with the Municipality of Anchorage Health Department and 100 public health nurses working within the school district?
That's a great question. Thank you for asking that. So yes, I would agree with your statements. And so we have been trying to work with the school district. We have done some events that really have leveraged both of our areas. We have an example of that is recently there was a change in that students needed to be TB tested for a particular program. And so we brought our nurses in to get those students tested for tuberculosis and then receive treatment if they needed to. And I think it's still a huge opportunity area. I think, especially as it comes to child immunizations, youth immunizations, I think that is a huge opportunity area for the health department that we need to leverage with our community partners and continue to build those bonds. We have our contact with Kathy Bell at the ASD, and so just really continuing to figure out what is going to work with our community and how we can help them out, how they can help us out, I think is going to be important, continued importance.
Thank you. I think you put your contact information in the chat, is that correct? I have been a employee of the Anchorage School District as a school nurse, doctoral prepared, and I feel I need to reach out to you to develop a stronger, more fluid and more equal partnership within the Anchorage School District and with the Anchorage Health Department. So I look forward to meeting with you.
Yes, that would be wonderful.
Great, okay, oops. I feel like we've only scratched the surface because I have like a bunch of other questions highlighted, and I think Taylor does too, and Lori probably does more. And it's already like 5:45. Yeah. So I wonder if you're willing, can we like do a part 2 of this conversation? And again, I'm not quite sure when we can kind of think about that and check with you for your availability.
Yeah.
I mean, I think what we'd love to sort of work towards is like some kind of, a little bit like what we're talking about with the language access plan, of some kind of list of recommendations or, maybe priorities that we could help you maybe get some resources for and connections to help fill. But it's going to take some more discussion, obviously, for us to get to where that becomes obvious. Taylor, did you want to just ask your question before we have to move to our next thing?
Sure. Thank you guys for coming. This was super informative and yeah, eye-opening. I think I have some stuff for part 2, but is there anything the health department works off of, like a community needs assessment either that you guys make or that you use to inform all of the work you do?
Yeah, that's a great question. So let me phrase it. We don't have a community health needs assessment, no. But I do know that the hospitals are required to have one, and so we utilize theirs. I do know that I believe Providence is about to go through their update, and part of that is connecting with the Anchorage Health Department. So I have a meeting, I think, next week with the individual over at Providence to start that process. But currently we don't have one, we use the hospitals. Kind of add on a little bit about that. And so as you become an accredited local health department, that is one of the processes. And so that is one of our goals in the upcoming future is to work through what's called MAP 2.0 through our health officials forum. And what you do is you create a community health needs assessment, and then you create what's called the CHIP, it's a community health improvement plan, I believe. And so you put those into place, and then you have a really robust policies and procedures, operations within your clinic, within your department to then become accredited. So that is one of our goals, probably one of our longer range goals that we have.
Can I just comment on a couple things there? So one is, I think maybe, I might, just tell me if I'm getting confused about meetings, but I feel like one of the very first meetings of our committee, we talked with Nathan at the time from Providence about their community health needs assessment. And am I remembering rightly? They went through their kind of robust efforts to get a diverse response, but also reported that it was a failure, like they really did not get a diverse response to their surveys. And I think it was one of the things that this group really said, hey guys, we could really help you with that. And as I know you're familiar with the Alaska Black Caucus did a Black Alaskans Health Needs Assessment, and those two studies were kind of happening around the same time, and I think ABC got like 700 or 800 respondents. And I mean, anyway, so I feel like that's something, when you have that meeting, maybe please put in a plug that this group would probably, I'm guessing many people here would want to be involved. And then the question just around MAP 2.0 and the CHIP and doing the assessment, is that something that HD needs additional resources in order to be able to do?
It would require a coordinated effort within the health department. I have not mapped out who internally we would kind of have start that process yet, but it would require that we have at least a full-time employee handling the coordination of all of that.
And I think Joan said in Laces had done one too, it needs assessment.
Okay, great. Yeah.
And
Lori and then Celeste, and then we'll.
Okay, I'll just say that to do a coordinated needs assessment requires the community to be involved at the very beginning, not to just come in at the end and be asked for data to be extracted from them. And so I would recommend that because that's one of the things we've learned. Yeah, I'm so sorry. I've got a volunteer I've got an awards presentation for the refugee.
Okay.
Event. Thank you.
all right.
Pastor May, did you want, because Celeste also wasn't going to. Okay, Celeste, go ahead.
Oh, I'm sorry, I didn't have, well, I should have taken my hand down, but since you called on me, I'm wondering,
if we talked about the reimbursement issue that smaller organizations have, having to pay upfront to get reimbursed when we secure grants.
Yeah, we touched on that a little bit ago, but I think that's another thing that maybe we could brainstorm some ideas around how to address that better.
Okay, great, thanks.
And I was simply going to say, we were talking, you were saying a minute ago about our space in July meeting, and since this is one of our major annual pieces, I would say we could invite them back for part 2 in our July meeting.
Okay. Yeah, I love that. Yeah. Okay, cool.
And then I can bring my document.
Great, okay, great, okay. This was really awesome, thank you both for being here, and yeah, we would love to have a part 2, and so we'll just be in touch by email about that. That's great. Okay, we just have a couple things before we wrap up.
Thank you guys, appreciate it.
Thank you. We do have, we just keep ringing this bell each time. August, we'll be electing new co-chairs, because we're both termed out. And we'll also be reviewing our charter. And Pastor Moody, should we wait till next time to talk about our couple of ideas about that, or do you want to do that now?
I think we got a few minutes.
Go for it. Or you want me to?
It's, no problem. We're thinking in terms of August is, as was stated, is our time to nominate and elect co-chairs for the ensuing 2 years according to our present charter, and had a couple of ideas on that. And one was, did we want to stagger terms for those individuals so that somebody would always be in place? Or another thought that was raised was, would we have a preference for nominating and electing a single chair and designating someone to be available when they are unable to do the chair, and then also be a sounding board for the chair in the know about everything, and do it that way rather than having two.
Through the co-chairs, you could have a vice chair and then essentially fill that role.
Do what now?
If you had a vice chair,
Right.
a chair and a vice chair.
Well, that's
fill that role.
that's kind of what I was saying. Yeah, and so those are a couple of options that, that are kind of there. And so we have, kind of given us notice to think about which direction we want to go, and have next meeting to kind of ring the bell again, as you, so to speak, said, at the time we get to August. And then we'll be making some choices, and whoever and whatever, as far as whatever system we choose, that person or those persons will start in September. Question?
Is it 1 year or 2 years?
Right now, it's 2 years for the co-chairs.
Well, we elect each year, but you can serve no more than 2 consecutive terms. And so we've done it for 2 years.
Well,
There's a version where, someone just gets elected for 1 year and then new group comes in, or, but yeah, that's how it's written right now. So I think those ideas I think are great. And I guess part of our discussion on that is just thinking, like, if it's too scary to think like you want to do it the way that we've done it, then maybe there's some other ways we can do it that would make it more opportunity for folks and make it a little easier. And then any kind of changes we need to update the charter, but we're supposed to do that in August too. So we just want to kind of put these ideas out there. And then of course people can bring other ideas too about any changes that people want to make to the charter. So.
My idea will probably be a 3-year term limit and re-electing both of you.
I don't think that's an option.
I heard you say we could take the charter.
Charter change, yeah.
Yeah, I guess you can stay there for another term.
Bye.
Oh my gosh. Okay. Okay, so we'll come back to that at our next meeting. We barely have time for assembly updates. Sorry about that. And do we have Felix is still with us? Anything you want to share that's really top of mind, Felix?
Yeah, I mean, nothing really comes to mind right now that y'all maybe haven't seen in the media already. So I guess if folks have any questions, I'm happy to answer questions.
Any questions for Felix?
I don't know that is a real question. It may take too much time, and maybe something we can visit on or what have you. But I did have some thoughts about the shift in mayoral leadership and what's going on with the police department.
Is there anything more specific?
Oh, you want me to be more specific? All righty. The outgoing mayor made a last minute appointment, and now the incoming mayor-elect has made another shift in it, and so those dynamics are something that I'm kind of interested in, but and maybe a discussion for another date or a more private discussion.
Any thoughts, Felix, you want to share?
Sure. I mean, I will just say that I guess plainly a new administration has the right to bring in new folks as they see fit. I don't think it's appropriate for me to speak to why the administration did that. You would have to speak to them.
Understood. Yeah, and I kind of felt like that would be the basic response to it, and I guess I'm sort of in process of doing just that. Yeah.
Well, and I think it raises a good point, which is at what point do we want to invite some of the new administration to come? And also, I'm super curious to know, who their chief equity officer will be. Will there be a change in that role? So that's something we can kind of keep tabs on. Okay, I think our last item is just, is there any audience participation?
Yeah.
Celeste?
Can we go back to what Pastor May was just talking about? I publicly, on the record, I expressed my profound disappointment in the decision to remove Cross as chief. And I've shared this with a few of you already. I firmly believe it was a significant and unnecessary mistake. I think about the police department, and don't get me wrong, I like Cross. Not Cross. I like Sean Case. But just think back when these policies came to be. It was Case and Curl who wrote these policies that unfortunately Cross found herself defending. And so she really got the wrong end of the stick. But now I understand, that Chief Case is going to come in and change the policies. And so I just think, as we're trying to increase diversity, and a female who is qualified, more than qualified. In fact, she's been there longer than Case. It's disappointing. And I think back to even with the chief equity officer, for years, we've been complaining in this committee about the lack of work in that area. We're the equity committee, task force, and yet, it's my understanding that this same individual is going to be retained. And so if we don't speak up for something, we might as well just fall for everything. And I just wanted to get that on the record. Thanks.
Yeah, thanks, Celeste, on that. And in deference to what Mr. Rivera was just saying a moment ago, I'm kind of in process of getting an audience with the incoming mayor-elect and kind of go over the thought processes in this as well. And so just want to get it on. Yeah.
Okay. Good, okay, those are all good things for us to be thinking about going forward. Any other items? Go ahead, that's right.
Oh, no.
Oh.
I was just gonna say we skipped one thing.
Oh, what did we skip?
Announcements.
Oh, crumbs, sorry guys. And we are like really almost out of time.
Yeah.
Are there any like critical announcements that should be shared verbally? Because we know we can always send them to Jasmine to go out to the whole committee.
Yeah, I'll send you a flyer.
Okay.
Yeah.
Director Ash, that was one thing also I wanted to share is that when AHD has things that need to go out to all the different organizations and individuals that are on this committee, you can send them to Jasmine and she'll send them out. So like if you have social media posts or you want to get the word out about an outreach event, like that's a great way to do it.
Thank you.
Yeah. Okay, great. Anything further? Okay, good to go. Thanks so much for being here. We'll see you next month.
All right.
Okie dokie. Oh, don't worry. It's nice to see you back.
Yeah.